This information is for a pain management patient who has chronic neck pain, back pain, or lumbar pain. Usually, this is for patients who have arthritis, degenerative disc disease, or degenerative joint disease, spinal spondylosis. It is called a nerve branch block. It is a 3 series procedure. They're not all done at once, they're done in 3 different increments. The first part is a diagnostic, the second is therapeutic, and the third is a radiofrequency ablation. So, what it really entitles is you come in, if you have medical necessity. It is an outpatient procedure, so you don't have to be put to sleep. You do get a pre op, but it's more for the pain of the needles. You'll come in early in the morning. It's about a 20-minute procedure for the diagnostic. What it is you'll come in and you'll be laid on your stomach. You will have 6 needles in your facet joints. So if you're having your lumbar done, it'll be your lower part of your lumbar, so your L5, L4, L3. If you're having your thoracic, it is your T12, T11, T9. And if it's your cervical, it's your C6, C5, and C4. So you'll come in, they'll put your 6 needles into your 6 facet joints of those levels. You'll be given Marcaine, which is a numb anesthetic. So you'll come in the next day and they'll do your upper segment, so your L3, L2, L1, your T9, T8, and T7, and then your C4, C3, and C2. And you'll also get Marcaine. Then you'll wait about 3 weeks because we want to make sure that it is your actual nerves that are causing your pain. So that's very important for us to wait 3 weeks because with it being injected into your actual nerve, it's not like a regular anesthetic where it just kind of wears off in a couple of days. So then you'll come back for your therapeutic. Well, your therapeutic is a numbing Marcaine or a numbing aesthetic, which is the Marcaine, and a steroid. So if you're a diabetic, you'll usually stay a little bit longer because a steroid will increase a blood sugar level drastically. So we only do that to make sure that your sugars, your levels are good so you don't fall out in our floor. So other than that, same thing, you'll come in your first day, they'll do the lower segment. Second day, they'll do the upper segment. You will get your Marcaine, which is numbing, and then you'll receive your steroid. Well, then you'll wait 6 weeks. The 6 weeks gives us a time gap to see if the steroid stays along with the Marcaine. So since you're getting double, they're going to double the weeks that you have to wait. So if your pain is good and it's starting to wear off around that time, you'll come to a radiofrequency ablation. This procedure is probably one of the best procedures that they've came up with. From personal experience, I used to work for a pain management clinic, and I used to see patients come in who could barely stand up. They have a bar from their neck down to their tailbone, and they're just in excruciating pain. They don't want to take pain medicine because they don't like the way it makes them feel. Well, I see them, have this procedure done, and I see them the next week. They look like a brand new person. They're walking. They don't need a cane. It's amazing what this procedure can do. So with this procedure, if you are eligible for it, it's the same prep, same concept, but the difference is you're hooked up to a machine. This machine is a radiofrequency machine, and it sends electric currents to your spine and to your nerve endings. You'll have 6 needles with a little tiny chrome tip at the end. It's probably about 1.5 inches long. That goes into your spine, or into your nerve, I'm sorry. And then what it does, it cooks your nerve, literally cooks your nerve. There's a video on YouTube, and it's demonstrating with an egg. It puts the needle into the egg, cooks it for 90 seconds. It pulls a piece of the egg out. The egg is representing, the piece that's cooked is representing your nerve that's cooked. It literally cooks the nerve so that it can shut off any nerve sensations to the brain. That way, you're not feeling any pain, or it's not sending signals to your brain saying, hey, this hurts, hey, that hurts. So it's a wonderful procedure to have done, if you're in such amount of pain. For some people, it lasts from 6 to 12 months. So you only get it maybe once a year. You may have a little bit of swelling, may have a little redness or discomfort because of the radiofrequency waves that are being sent into your spine. You will have a pad that is placed on your legs, so you don't have to worry about any additional waves being trapped in your body and something, making your heart stop. You don't have to worry about any of that. We got that covered. This procedure actually originated with the carbolic acid theory. That originated probably back in the 70s or 80s. The first doctor that actually started doing it at Columbus was Dr. Serrato. He was an orthopedic surgeon at St. Francis, and the FDA decided that that was not as safe, and they were a little questionable about the carbolic acid because it did throw off the pH balance in the body. If it wasn't absorbed correctly, and not everyone's body absorbs the same way. So that's when the FDA was like, hey, we're going to come up with this machine that basically does the same thing, but it's safer, it lasts longer, and it really is doing wonders for a lot of people, people that are overseas. It is something that is marvelous for people to use, especially, like I said, with the pain. It's amazing to see how amazing it can just change your body in, a matter of 20 minutes being in the procedure room. This one you don't have to worry about your blood sugar if you're a diabetic because you're not receiving anything but Marcaine, which is an anesthetic, and that's only for, comfort of the patients. Depending on which doctor you go to, they may give you more. Some may prep you a different way, but usually the standard is they give you Marcaine or lidocaine in the needles before they actually start the procedure. You don't have to worry about going to sleep. It's an outpatient procedure as well. You do have to get a checkup probably about 2 weeks later to see if you're still having any type of issues, if you're having new issues, if you're feeling new pain anywhere. Then that's something that we really need to know, because we don't want to have to continue to give you these procedures and it's not working. So I would definitely spread the word, let everyone know, if you have chronic pain and if you're any sciatic, spondylosis, degenerative disc disease, degenerative joint disease, this is definitely a really good procedure to do. It is a little time consuming because it is a 3 series, but like I said, I worked at a pain center before and I have seen miracles of patients not being able to walk, not even being able to get out of a wheelchair, and the next week they're moving around. I think I've seen one try to do a cartwheel. I mean, it is just miraculous of what medicine can do. And for those that don't like taking pain medication because they don't like the way it feels, well, now we're making ways that you don't have to, and you can still live your life as a regular person with this procedure. So I would definitely let anyone know that needs something like this to look into it, to research it. Speak with your doctor, and if you go to a pain management center, speak with the specialist there, and I would definitely recommend it for those.